Hi, I'm Tom Burke, the Associate Dean for Public Health Practice here at the Johns Hopkins Bloomberg School of Public Health. And welcome to Public Health on the Inside, your inside look into the world of public health. The first week in April is National Public Health Week, and this year's theme is Public Health is Return on Investment. Save lives, save money. Obesity is a devastating disease which impacts the quality of life of individuals across the U.S. In addition, it puts a tremendous financial strain on our health systems, leaving the obese at an increase for a wide variety of diseases, including type 2 diabetes and cardiovascular disease. Today, I want to introduce you to Dr. Sarah Blash. Sarah is a colleague of mine in the Department of Health Policy and Management, an associate professor. And I have to tell you, she is, within our field, a set of bright, new eyes taking a look at public health challenges in a new way. I know often when we talk about saving lives millions at a time, we profile people who've had an impact over the course of long careers. Sarah, relatively speaking, is in the early stages of her career, and already her messages about obesity and policy are reaching millions at a time. Her research focuses primarily on obesity prevention and control. Let's face it, any of you who've tried to lose weight after perhaps getting a little heavy realize that prevention is the way to go. Her body of work seeks to understand the drivers of obesity, improving physician care of obese patients, developing environmental strategies to reduce caloric intake, and generally getting a message out there to make people more aware of that relationship between what we eat, how we act, and obesity. Sarah, it's great to have you here. Welcome to Public Health on the Inside.
Thank you for having me.
So let's start off with the obvious question. No pun intended, but how big an issue is obesity in terms of the public health impact? Give us some background on the size and scope, the epidemiology of this challenge.
So there's no question that in terms of burden of disease in the United States, that obesity ranks up there in terms of one of the top leading causes of preventable death in the United States. So in a given year, about 1 in 3 adults are diagnosed with obesity. So that's about a third of the population. It's even higher among minority women, like Black and Hispanic women. If you look among the pediatric population, so children ages 2 to 19, it's about 1 in 5. So about 20% of kids are overweight or obese.
That's amazing. All of us have seen it. Frankly, I'm a little older, and I have seen it happen quickly in the U.S. I remember being at CDC when we got the first briefings in the 80s about the changing pattern of weight in the U.S. from the national surveys, and yet it's happened in 20 years. The population has changed.
That's exactly right. So if you sort of look at the trajectory over time, we first started documenting the problem in the late 60s, early 70s. And it was right around that time where you saw this dramatic increase. And so the rise that we've seen over the past 4 decades in obesity, tripling among children or quadrupling among adults, cannot be explained by genetics. This is an environmental problem driven by people either doing one of 2 things. They're either eating too many calories or they're exercising too little. If we sort of ask the question, is it really calories or exercise? Among adults, it's a pretty clear answer. Adults are eating too many calories, and for that reason, they're gaining weight. Among kids, it's more of a mixed bag. It's a combination of not exercising enough and eating too much. But in general, if people ask me the question, how do I lose weight from an efficiency standpoint? Eat fewer calories and you will be successful.
It happened quickly, which means that we as a species haven't changed. This is an environmental thing.
That's right.
But usually that's a promising thing for people who are focusing on prevention.
That's right. So the tricky thing with obesity is, unlike something like tobacco where we can say lung cancer rates went up very quickly because people were smoking, obesity, while we understand that, again, biologically it's either too many calories or too little exercise, there's all these things that are driving us to either eat too much or exercise too little. And that's where the science is somewhat incomplete. And so we have some understanding of things, for example, in your neighborhood that increase your risk of obesity. So, for example, living near fast food restaurants, living in areas where you can't exercise very safely, living near supermarkets is protective against obesity. But we don't have a great sense of all the different drivers. So it's hard to figure out the exact right way to prevent it. What's clear is that if you have more comprehensive approaches which involve children and their families and their schools and their communities, those are more effective than targeting one small piece of someone's life.
In public health, we are very fortunate that our jobs sometimes don't even feel like jobs. We have more like vocations than jobs. And you're obviously passionate about this. What prompted your interest in obesity research?
So it's both personal and professional, and I'll start with the personal side. So I am originally from Baltimore, actually, and my grandfather on my mother's side was a corn farmer with very little formal education. And so I had the great fortune of going to Harvard for graduate school. And when I got in, it was a very big deal for my grandfather. And so he was a man of very few words. And when I was on my way up to Boston, he pulled me aside and he said, "Sarah, don't you go up there and get uppity." And so I sort of laughed it off and sort of said, "Okay, Grandpa, whatever." And when I got there, and I had been there for a couple of years, and I was trying to pick a dissertation topic, his words came back to me. And I had been working on projects that were very hard to explain, and I thought, I am a practical person. That's what draws me to public health. I want an issue that the average person can understand. And so I remember just one day, I was sitting there and I was thinking, and I said to my now husband, I said, "I'm going to study obesity." And he said, "Why?" And I said, "Because my grandfather will understand." And so I called him later that day, and I said, Grandpa, I'm going to write my thesis on obesity. He had no idea what a thesis was. And he said, "You're going to make fat people thin?" I said, "I'm going to make fat people thin." And to me, he is middle America. And so if he could understand what I'm doing, the average person can understand what I'm doing. And then professionally, I wanted a topic that was policy relevant, which meant that it would get a lot of attention. I wanted something that touched the mainstream populations and marginalized populations, and I wanted something that was international and domestic. So obesity for me was all those things.
Well, we want to thank your grandfather for giving you a grounded outlook, because I have to say, your take on science has been amazing to me. Many of us get really caught up in data and experiments and journal articles, but you cut right to the chase. After the Super Bowl, for instance, you made national news. Now, all of us watch the Super Bowl, and we all love the commercials, but you saw them through a different lens. Tell me about your Super Bowl experience as you looked at all those great commercials for food.
That was actually quite fun. So the day after the Super Bowl, I got a call from a reporter, and she said to me, "I want you to give me a sense of how many calories are in the food that people would eat on a typical Super Bowl." And so we went through the calories, and it was really quite remarkable. I think it was something like 4,000 or 5,000 if you were to eat everything you saw in the advertisements that you saw in the Super Bowl. And the average American adult should take in about 2,000 calories a day. So we're talking about, 200% more than you actually need.
Wow. And that was a message that resonated. I might add, Baltimore won the Super Bowl.
That's
Everybody's aware of the Super Bowl. What a great public health teachable moment.
That's
so congratulations for having that viewpoint. And thanks again to grandfather. So policy is tough on obesity, though. We talk about very difficult challenges in policy and public health. We've had guests talk about gun policy. Food policy is also a very touchy subject. Our namesake, Michael Bloomberg, has been a real trailblazer on this, particularly regarding the large-size sugar beverages in New York City. But we've gotten some new news on that. Tell me your take on that and policies that might work.
Yep, that's exactly right. So New York City, under the directorship of Mayor Bloomberg, has been one of the most progressive cities when it comes to trying to figure out ways to make the population healthier with respect to weight loss and weight maintenance. And the most recent ban that has gotten so much attention was Michael Bloomberg's ban to say that there could be no drink sold within the city that were larger than 16 ounces. That means no more of these 20-ounce bottles of soda. Legislation passed this past summer. It was set to go into effect, except a judge came out and said that the ban was actually not going to go into effect. It was not legal. And that lawsuit was brought by a group of business associations like the American Beverage Association. Now, this happened before with calorie labeling in New York City. The Restaurant Association came forward. Michael Bloomberg got pushback, the ban was overturned, and he eventually was successful. So a similar thing may happen here. From a big picture perspective, stepping back, these sorts of policies are so difficult because, number one, the food and beverage industry is extremely powerful relative to public health. So if you think about sort of the pie and the amount of resources, public health is a drop in the bucket compared to the resources available to the food and beverage industry. So they have a tremendous amount of infrastructure to sort of combat these sorts of pieces of legislation. And so efforts like Bloomberg is making are very progressive. They're really pushing the agenda forward, but they're difficult because of all these vested interests. And so we're going to continue seeing movements in this direction, but it's going to be, I think, each time sort of back and forth with public health pushing, industry pushing back, because when there's so much money invested, any change to the status quo is very disruptive.
And that's a challenge to us with decreasing funding for research, because science should really be able to inform this debate.
That's exactly right. And in fact, what's interesting is that the most recent obesity policies are actually examples of where they've passed policies where you don't actually have the best science behind them. So calorie labeling, part of health reform, which says that if you're a chain restaurant around the country and you have more than 20 outlets, so if you're McDonald's or Chipotle or KFC, you are mandated as of 2014 to post information about calories on your menus alongside price. there's not great evidence that it works well. There's some that says it does and some that says it doesn't. But we need research so that we can really understand what makes the most sense so that when these windows of opportunity come along from a policy perspective, we can really jump on them and take advantage.
I have heard that there is beginning to show some very good news about kids, though, and that our efforts in public health are not in vain.
That's exactly right. So the Centers for Disease Control, they are responsible for tracking trends in childhood obesity. And the most recent surveys have actually shown that there's been a plateauing or leveling in childhood obesity. And so that's across the board. So if you look at all kids on average, it looks like rates are not continuing to go up, which is wonderful news. Now, if you sort of then say, but what about some of the groups we know are at higher risk? So you take Hispanic boys, you take Black girls, we're still seeing increases among those groups. So we should be very happy that in general kids are getting better, but we should be concerned that low-income minority kids are not necessarily doing better. So to think about how can we target those kids and do more effort in that area.
This is hopeful, though. There's good news. We've got to work harder.
That's right.
I want to talk about prevention. I want to switch gears a little bit. As I mentioned in our opening, National Public Health Week is just around the corner, and this year's theme is return on investment. It seems like taking on obesity, this modern-day scourge, is one way that we could really prevent an awful lot of disease, saving lives and saving dollars, millions at a time.
That's exactly right. So if you sort of step back and ask the question, how many people die in a given year because of poor diet or physical inactivity, so the main two drivers of our obesity epidemic, you're looking at about 500,000 people a year that are dying for that reason. If you then ask the question, how much does obesity cost us, you're looking at about $147 billion annually in direct medical costs. So it's a very expensive problem and is very much preventable. A challenge, obviously, is how do you know how much money to put into prevention versus other things? And I think that there's an increasing interest in saying, because it is so incredibly hard to help a person lose weight once they've gained it. In particular, once you get heavier, you gain weight even faster. How do you stop people from ever getting to that point to be overweight or obese? And so there's a lot of interest in the research community and increasingly in the policy community to say, how do we keep people in a healthy range and then maintain that over the life course?
The best way to curb healthcare costs is to prevent illness and prevent disability.
That's exactly right.
I want to close on a personal note. You're from Baltimore.
I'm from Baltimore.
That's great. So lots of our students thinking about their choices are thinking about Baltimore, and I'd love to hear your perspectives on this city.
So, Baltimore has a lot of different unique qualities, and I will be very honest with your listeners, and I will say that growing up here, I didn't always love it as a child. I've always been a big city girl. I raced off to go to New York City for college, and I raced off to Los Angeles after that. And now that I've been back, I have really been pleasantly surprised. I think the city, some of the things that make the city so exciting from a public health perspective is, number one, it's very progressive when it comes to public health. So we are one of about a half a dozen cities around the country that has our own food czar, who's very actively engaged in thinking about how do we involve urban policy and public policy and health policy to figure out how to make the environments healthier for people that live in Baltimore City. Because we are a small city,